Please call the roll.
Okay, I'll begin with the official roll call. Norman Boyd.
Here.
Roger Folsom.
Here.
Russell Crutchfield.
Here.
Russ Childers. Russ Childers. You'll have to unmute yourself.
I'm here.
Thank you, Mr. Childers. David Cruz.
Here.
Mark Trail.
Here.
Kenneth Davis. Kenneth Davis. And Mr. Williamson provided prior notice that he would not be able to join, but just for the record, I will call his name Anthony Williamson. Chairman, that concludes my roll call.
Thank you, Denisha. And with that roll call, I see that we do have a quorum, so we can conduct our business today. I'll call the meeting to order. We have an agenda today of really one subject, and but a very important one, as we it's our tradition each year. In our second board meeting in the month of August, we address the budget, and that will be our topic this morning, and we'll be asked to take a vote later in the program. Just to kick us off this morning, I will turn it over to Commissioner Nagel for the Commissioner's report.
Thank you, Mr. Chairman. I'll keep it pretty brief this morning, but did want to share just a couple of updates with the board members. Last time we met, we spoke briefly about the recent EPSDT report and kind of our ranking among states around those referrals for service in children among that report. And I mentioned to you that we were going to do some further analysis into that. Preliminarily, it looks like there is some anomaly potentially in the data or the calculation methodology. There is an option where the agency can calculate those figures and reports, or have CMS generate those numbers for us. When we went back and looked at the CMS generated reports, the number ended up for referrals for treatment 15 times higher than what we were reporting, which was a much better metric for performance. So we've actually engaged one of our existing audit partners to go back and look at how our systems are calculating that information to figure out if that's an error on our side of who we're including in that numerator, or if there's some other error in the calculation methodology. So we'll continue to keep you posted on that, but that's a little bit, I'm hopeful of some encouraging news that maybe our performance is better than we thought. As the chairman mentioned, you will hear the agency's budget request recommendation this morning. Continues to support kind of our ongoing high level of Medicaid members, as we are still under the federal public health state of emergency and are not removing any ineligible members from the rolls right now. It's pretty straightforward and mainly just supports workload and growth measures in those categories. Special thanks to the finance team for their work on that. They can attest to the fact that they probably get more than normal questions from me, given my background, and I appreciate their patience and their work putting this budget request together for you. And just one last item, I wanted to thank Melanie Simon for her service to the agency as the Division Director of Healthcare Facility Regulation. She is leaving the agency at the end of this month and has actually taken a new position with another state agency. But just wanted to thank her for her service. She's leaving big shoes to fill, but we are actively working to recruit and fill that position. So thank you to Melanie for that. That concludes my report, Mr. Chairman.
I would ask that, I'm sure I can speak for the board. We've had several presentations from Melanie over the last several months and years, and we please pass along our thanks for the work that she has done for the agency.
Will do.
Are there questions or comments for the commissioner, please? Hearing none, we will move forward for the main part of our meeting today, and thank our CFO, Lisa Walker, who will make a presentation this morning, and thank her and her staff for the advanced information that we received and been able to look at prior to the meeting this morning. So, Lisa, would you please proceed?
Thank you, Chairman.
Good morning, Chairman, Commissioner, members of the board. I will be presenting the amended fiscal year 20.
Excuse me,
Can you hear me?
Lisa, we're having a little trouble, I am anyway, hearing you.
Can you hear me?
Not real clear. Can you turn the volume up somewhere?
Yes, it's at its max. Can you hear me a little bit better now?
What about the other board members? Can you hear her?
I'm okay.
Yeah, I can hear her as well, Tim.
Okay, go ahead, Lisa.
Okay. I'll be presenting the amended fiscal year 2022 and 2023 budget for the Department of Community Health. I want to begin by covering some of the highlights from fiscal year 2021 related to beneficiaries that we cover and the expenditures related to those beneficiaries. Advance to slide 5, Kiana. Thank you. Within the department benefits programs, as you can see on this slide, 55% of the beneficiaries were low-income Medicaid, 22% was state health benefit plan, 18% were age blind and disabled, and 5% were peach care. Of those beneficiaries, 95% are children, pregnant women, disabled, elderly, and SHBP members. In low-income Medicaid, of the 55% that you see represented there, 82% of the beneficiaries are children. Next slide, Kiana. According to the Kaiser Foundation report on child enrollment in Medicaid and Children's Health Insurance Program, referred to as CHIP, in Georgia, we refer to it as peach care. Georgia is ranked 6th in the nation for child enrollment. Child enrollment in Georgia equates to 1,626,818 children. That represents approximately 58% of the population of children in Georgia. And the population of children in Georgia as of the 2018 census was 2,818,000 as it relates to the children. Next slide, Kiana. And as we take a look at expenditures as it relates to the beneficiaries, the department expended $16.6 billion in total funds related to the beneficiaries in the Medicaid program. 3.3 billion of those funds were appropriated state dollars. Of those dollars spent, 52.16% of those funds were in age blind and disabled, 40.44% in low-income Medicaid, and 2.21% in peach care, with the remaining of those dollars expended throughout other programs within the department, as you can see. You see a different correlation of expenditure percentages as it relates to beneficiary percentages, and that is due to the fact that beneficiaries within age blind and disabled have a higher cost, healthcare cost associated with them. And based on the expenditures and the beneficiaries, as of fiscal year 2021, it's a general highlight in terms of how the appropriation and the dollars were spent as it relate to the Department of Community Health in the Medicaid program. Next slide, Kiana. On July 1st, the department started the year with an appropriated budget of $17.3 billion, with state funds comprising approximately $4.1 billion. Of that appropriation, you will see the spread in terms of percentages the same as how we serve our beneficiaries and how we expended dollars in the prior fiscal year. 53% of those funding were appropriated in age blind and disabled, 40.87% of funding in low-income Medicaid, 0.91% in peach care, with the remaining spread throughout the other programs at the department. As you can see, 97% of the state funds we receive in appropriation are actually appropriated in the Medicaid benefits program at the department. Next slide, Kiana. The next couple of slides will be related to the department amended fiscal year 21, fiscal year 23 budget requests. as I present to you the request, you will see that the items are for growth and other changes that support the Medicaid benefit programs. I'll begin with amended fiscal year 2022. First of those items is in departmental administration and program support. We are requesting $3,446,489 to support enrollment-based growth in the Georgia Medicaid Management Information System. When enrollment goes up, we have to support the cost in the system in terms of postage and any other correspondence that goes on. This request supports that additional cost, the increase in enrollment. The next item is for growth in the benefit programs, age, blind, and disabled, low-income Medicaid, and Peach Care. First of those items is growth, and this growth is also attributable to a higher than expected enrollment growth in the benefit program. The request is for $342,868,700 for the benefit. The next item is for a Pulmonary Medicare Part D clawback request. This request is for beneficiaries who receive Medicare and Medicaid and are eligible for the Part D prescription drug coverage assistance. The request is the portion that state has to provide on behalf of those who are referred to as dual eligible. The current rate as it stands is $84.54. And beginning January 2022, and it functions on a calendar year, rate will be $112.34. And that item is in the amount of $8,840,400. The next item is for private disproportionate share hospitals. The request is $2,714,137. Disproportionate share hospitals serve a significantly disproportionate number of patients, which results in uncompensated care costs. Private hospitals are participating in DISH, as we refer to it at DCH, do not have intergovernmental transfers like public hospitals. Hence, the state funds are needed to draw down federal funds for the private hospitals. And that's what this request is for, the private hospital match to draw down the federal funds for DISH. The next item is for changes in the federal medical assistant percentages, FMAP, as we refer to it as. It is a reduction of $235,130,395. As a result of the public health emergency, federal guidelines allowed states to receive an additional 6.2% in the federal percentage, which resulted in a reduction in the state percentage of the medical participation. The total request for the amended fiscal year 22 is $122,742,417 for the amended year request package for Department of Community. Next slide, Kiana. The next requests that are for fiscal year 23 items, and many of these items are the same as the amended fiscal year 22 request. I will go through those items briefly, but the items that are new, I'll make sure that I address those items in detail for you. Next item, next slide, Kiana. In Departmental Administration and Program Support, we are requesting $1,696,685 to support enrollment-based growth in the system also. And it's similar to the one that you saw in the amended fiscal year. The next item is for growth also in the benefits program, age, blind, and disabled, low-income Medicaid, and Peach Care. The request is for $336,660,812. Once again, this is related to the growth that we are seeing in the benefits programs. Next request is for Medicare Part D clawback for $15,400,022. And this is for the dual enrollees who are in Medicare and Medicaid. The next item, which is a new request that you did not see in the amended fiscal year, this is for a change in the federal medical assistance percentage. And what makes this different than the previous one, Previous was enhanced in the amended year. This is a return to a normal reimbursement percentage after the end of the public health emergency. And this request is in the amount of $5,201,300. And this turn to normal will be going from a blended fiscal medical assistance percentage of 66.9% to 66.86% once the public health emergency is complete. The total request for fiscal year 2023 is $358,969,904 for the amended fiscal year request. Chairman and board members, this concludes the request for the Medicaid program, but I also want to give you an update of the financial status of the state health benefit program also. Could you advance the slide, Kiana?
Excuse me, Lisa.
Yes.
Can we pause here before we go into this next subject? Are you asking first of all, I asked if there's any board members that have questions or comments. I'm still having a lot of trouble hearing, but are there any questions or comments from the board, please?
Mr. Chairman, this is Mark Trell. I do have two quick questions.
Yes.
First of all, Ms. Walker, we saw, probably all of us on TV, the governor said no new requests in the budget other than inflationary growth. Your presentation seems to be consistent with that?
Yes, it is. Usually with the budget instructions that comes from the Office of Budget, the requests are usually, growth is usually exempt from that.
Understood. Thank you. One other question, just for, what's left of my memory these days. The Part D clawback, does that relate to premiums or rebates that we've collected?
Premiums.
Premiums. Okay. Thank you. I yield, Mr. Chairman.
Any other questions, comments?
Mr. Chairman, this is Russell Crutchfield. I have a quick question for Lisa. Lisa, thank you for your presentation. This is great. I have a question about slide 11, the benefits growth slide that you have on there. Is the benefits growth consistent with previous years? I think it used to be like 2 to 2.5% year over year. Have we seen a change there, or is it still pretty consistent with what we've been saying years past?
It's somewhat consistent. It's just that we have a spike in enrollment, and you'll start, if you look at the request, it's actually lower in 23 than in 22, and that's because you begin to see the enrollment start leveling off. So we trying to look at growth trends as it relates to enrollment, utilization, and all that nature. But you will see it in 23 start leveling off. It's as consistent as can be during this COVID period.
Perfect. Thank you so much.
Mm-hmm.
Any other questions or comments? Lisa, now you're going to call, or maybe I missed it. Are you calling for, are there two votes you're going to call for here, or on this, on the amended is one and the 23 budget is a second vote, or are you calling for one vote or none at all?
No, sir, I wasn't calling for a vote yet. Usually I call for the vote after I give you the SHBP status.
Okay. All right, please proceed.
Okay. Next slide, Kiana. Usually I give you an update of the SHBP financial status. For the SHBP State Health Benefits Program status, in the projection that we usually show you each year, we examine the status by looking at the revenue versus expenditures to give us a net position related to whether the program is operating in a surplus or a deficit, and shows us what that impact might be on any fund balance that we have as it relates to the state health benefit program. Revenue within the state health benefit program is generated by employer contributions and employee premiums. Usually that's a 76%, 23% split respectively, with 77% as the employer share. For the expenditures, our actuaries look at medical trends, utilization, and other changes within the commercial market to give us best estimates as it relates to our projections, as it relates to our state health benefit program. I want to begin by having you look at the past fiscal year 2021. As you can see on the slide, the program generated $3.7 billion in revenue. However, expenditures was trending higher and outpacing revenue, which resulted in the program having a deficit of $88,979,520. Keep in mind that the fiscal year 2021 numbers that you see are unaudited numbers and will be final during the fall when the Department of Audit completes auditing our books and additional claims come in to finalize those numbers. Usually the way we cover a deficit is we utilize prior year fund balance as it relates to that. Only the fund balance related to SHPP, not OPEB, because OPEB can only be used for those retirees that that have retired from the state of Georgia. As you look at the projected fiscal years, 2022, fiscal year 2023, fiscal year 2024, the pattern continues related to expenditures outpacing revenue and the deficit growing a little bit larger, and the use of more of the fund balance might be needed to help support that. We do have internal conversations as it relates to how we might manage this, but it's not only internally within DCH. We will have to have ongoing discussions with the Office of Planning and Budget to see what additional options we might have to implement to help fund the program for additional revenue, and that can be multiple options that we could consider. However, currently the projection is as it stands, and it will be updated in the fall with new information that we will receive as we continue to finalize our close for the fiscal year 2021. And at this time, Chairman Boyd, this concludes the presentation of the Department of Community Health budget. And at this time, I would ask for any questions related to state health benefit. If there are not any questions, I would like to ask for the approval of the Department of Community Health amended fiscal year 22 and fiscal year 23 approval.
Are there questions from the board, please?
Mr. Chairman, Mark Trail again.
Yes.
Just to restate, Ms. Walker, I believe that you said that OPEB is not included in the SHPP figures you presented at all. That's a whole different bucket.
The OPEB that you see on the slide is only in the fund balance amount. Usually, if there's a deficit that you see in terms of current active SHBP plan, we cannot apply that deficit to OPEB, only to the current SHBP fund balance.
Okay. Yeah, I probably will have more questions about that, but let me not spend the board's time on that, Mr. Chairman. I'll yield.
Any other questions from the board? Hearing none. Lisa, again, I'm not quite clear. Are you asking for two votes, one on the amended 22 and another on the 23 budget, or are you requesting one vote that covers both?
Chairman, I ask for one vote to approve the Department of Community Health budget for amended fiscal year and fiscal year 2023. One vote.
Okay, thank you.
Mhm.
So is there a motion for that approval for both the amended and the 23 budgets? Is there a motion for approval?
Trail will so move.
Mr. Trail has made the motion for approval. Is there a second?
Crutchfield, second.
Mr. Crutchfield has seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. And thank you very much, Lisa, for your presentation and the work that went into this for our review. Thank you.
Thank you, Chairman.
Is there anyone who knows of any new business that needs to come before the board at this time? Hearing none, the meeting is adjourned, and thank you very much for participating today. Our next meeting will be on September 9th at 10:30 a.m. So thank you, and you all have a nice day.
Thanks.
Thank you.